Hello, everyone. Welcome and thank you so much for joining us for the virtual Canada Health Infoway Partnership Series. I'm Suhanna Marchand. I am thrilled to be back as your MC. We've had some fantastic sessions in the past. I'm sure this one will stand up to all of those. We do have attendees participating from across Canada and around the world, and I would like to take these opening moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and continue to affect their well-being. Canada Health Infoway respects that Indigenous peoples have rich cultural and traditional practices that have been known to improve health outcomes. So I invite all of you as attendees to reflect on the territories you are calling in from as we commit together ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. As a journalist, I have the incredible privilege of covering top news stories, interviewing newsmakers from across Canada and around the world. And certainly the pandemic and our response to it has been, making news over the past year and a half. And now our attention turns to a federal election. And I'm sure that, as in the past, healthcare will be a huge issue for Canadians from coast to coast to coast. So you could say I'm even more interested in our discussions today as we ramp up to our day at the ballot box. In order for those discussions to work really well, let me share a few things with you. We do have simultaneous interpretation available for all Infoway Partnership Series sessions. So if you would like to listen to this session in French, easy to do. You can follow the instructions on the screen. You'll see them right now. We also have closed captioning services available. That's easy as well. To enable English closed captioning, simply select that CC button. It's on the bottom right of your video player. The virtual Infoway Partnership Series is proud to be patients included. Infoway is pleased to continue to convene events which adhere to the accreditation. In collaboration with patient partners, Infoway has developed the Patient Family Caregiver Recognition and Inclusion Statement. And this statement really just acknowledges the critical role of patients, families, and caregivers, and underscores Infoway's commitment to collaborate with them as it works towards improving our healthcare system. So let me take a moment and just read that statement. Here it is. We recognize the unwavering commitment and essential impact patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. We look forward to building true partnerships and acknowledging shared successes. Now, the patient advisor for this August 17th partnership series, you can see her on your screen, Emily McIntosh. So a great big welcome to you. Emily has been an advisor for the overall program development. So Emily, a sincere thank you from the team, your colleagues at Canada Health Infoway, for your support. Now, we have planned to allow for a few questions at the conclusion of all of the presentations, should time permit. So let's hope there's some time and we'll get your questions in. But please submit your questions throughout the program via the Q&A box. It is under the main stage video stream. So we'd love for you to participate share your questions. We'll try to get to them. And then at the conclusion of today's broadcast, please share your event feedback. You guys have all done this. You've asked for surveys and you get few of them. Sometimes you get a lot of them. We're hoping to get even more than a lot of them. You can find the survey at the right-hand side of the screen. It really helps to make the next sessions better and geared to the things that you would like to discuss. We also welcome you to engage with your fellow event attendees in the platform chat. And you can find the chat easy again by clicking on the blue talk bubble icon. It's at the bottom right-hand corner of the screen. Now that chat can be used to share your comments with all attendees, so a public comment, or you could message specific attendees directly and have that chat with you and perhaps another attendee that you wish to speak with. All right, enough of the housekeeping notes. Why don't we get right down to the program? We're going to kick off with the Canada Health Infoway welcome and update from Sheila Maloney, Executive Vice President of Engagement and Marketing at Infoway, and Dalia Kablawi, patient partner and member of the Virtual Care Change Program Advisory Committee. Now, unfortunately, Dalia couldn't be with us live, but she has recorded this message, so here it is.
Hello, everyone. My name is Dalia Kablawi. I'm a patient partner and a member of the Virtual Care Change Program Advisory Committee, which is co-chaired by Canada Health Infoway and Healthcare Excellence Canada. As a member of the committee, I'm able to provide a patient lens to the overall change program, including the Virtual Care Clinician Change Management Project, which you will hear more about shortly. When developing a program such as this for clinicians, it's important that the patient perspective be included to ensure that the needs of patients are adequately being considered and met. In my personal experience with mental health care in particular, there can and should be measures implemented to provide more accessible and equitable remote care, noting that marginalized populations, often most disproportionately impacted by mental health challenges, face greater difficulty accessing remote care. I would now like to introduce the Virtual Care Clinician Change Management Project, which is one of the several initiatives Infoway has underway through funding received from Health Canada. The goal of this project is to help transform care so that more people can benefit from equitable, safe, and culturally safe, high-quality virtual care. COVID-19 has changed the landscape of healthcare immensely, and clinicians and patients have had to pivot to virtual care very quickly. Through this project, we are aiming to provide clinicians and their support staff with the appropriate tools and resources to effectively adopt and use virtual care solutions to meet the needs of patients, families, and caregivers. I would now like to pass it over to Sheila Maloney, Executive Vice President at Infoway, who will provide an overview of the work to date on this project.
So thanks, Dalia, and thank you not only for sharing your experiences with us today, but for the work that you do as a patient partner, not only on our Infoway initiative, but the other work that I know that you do on behalf of the health system. As Dalia mentioned, I am Sheila Maloney, Executive Vice President at Canada Health Infoway. And so on behalf of the organization, it's my real pleasure to welcome you to our August Partnership Series, one of, I think we're at number 4 so far, and we've got a number of series events monthly going on between now and the end of the year. So certainly hope that you can join us for those. So it's my privilege to talk to you today about our virtual clinical change program. And so you'll see through this slide, we've sort of kicked off officially in sort of the April-May timeframe. And we've made a number, we're sort of halfway through our discovery phase. We've done a needs assessment, we've completed some environmental scans, and we've identified a number of management solutions or change management solutions and tools that we will incorporate into a toolkit that we will be testing in the next phase of the project. I think one of the key things that I want to emphasize through this presentation is really stakeholder consultation. We have engaged with clinicians, with patients, as you've heard Dalia say, with support staff and clinical offices, our provincial territorial government partners, our pan-Canadian health organizations, and particularly I want to mention Healthcare Excellence Canada. They have been our partner in this particular project, and they will certainly play a leadership role in the Learning Collaborative, which will come up in the next phase of our project. I think one of the things that on the next slide, when we talk about our research and information gathering, if I can only emphasize one thing, this is a toolkit for clinicians and for their support teams around how to optimize a virtual care experience. So we have done extensive consultation. That has been the primary key focus of this particular project. We've conducted interviews, we've hosted focus groups, and actually we just finished a 200 plus clinicians have responded to a survey that we conducted recently. And I should just to be clear, this survey is different from the CMA Infoway survey that you're going to hear Michael Green and Dr. Ann Collins talk about later in the program. Complementary to, but not the same as that survey. And this survey was really about validating the findings that we heard through our needs assessment. Again, very much lot of people have inputted into this process, which we are very thrilled about, and getting a lot of really good feedback to make sure that we have the toolkits and provide the tools that will be optimal for people when they're actually implementing these initiatives. So what did we find? So on the next slide, through our discovery process, there are 3 key areas in which we will focus our work. The appropriate use of virtual care. So what this really means is making sure that, we know virtual care is one modality of care delivery. And we want to know, when is it most appropriate? How do you assess patients' readiness? So those are the kinds of things that will be included in that sort of component of the toolkit. The second one we're sort of calling quality and safe virtual care interactions. So again, virtual care is not the same as in-person care. So it talks about website manner, talking about how do you interact and build a relationship virtually. Are the diagnostic cues a little bit differently when you're doing these things remotely? So those sort of the gamut that fall into that component. And I should say culturally safe care is included in here as well. And so we've been asking especially about that as well, and want to make sure that we test that and make sure that our toolkit addresses some of those issues as well. And then the last category is really use and optimization of virtual care services. So that gets into the technical support issues, things like workflow integration. We want to make sure that privacy and security and all those sort of issues that are prerequisites to making an effective virtual care interaction are there and can be addressed, and that people have access to those types of services and tools for which when they need them and if they need them. The other thing to mention is then, and loudly and clearly we heard through our interviews, through our focus groups, and our consultations with clinicians and support staff and others with whom we've consulted, we recognize there are systemic barriers to virtual care in some areas. So infrastructure is one, remuneration policy is another. And so we acknowledge and recognize the importance of these issues. And while they're not necessarily in the scope of this particular project, we, Canada Health Infoway, Healthcare Excellence Canada, our PCHO, Pan-Canadian Health Organization partners, Health Canada and others, we certainly are committed to supporting these activities and activities in this area. We know how critically important they are to have an optimal virtual care experience. So we want to recognize those, but they're just outside of the scope of this particular initiative. So that's sort of a high-level overview of what we're doing and how the project is progressing. We certainly remain committed to keeping you informed and involved. There are a couple of things just to mention as we close here. We have certainly look forward to getting your feedback and any comments that you have. If you have any suggestions or questions, we'd certainly like to hear them. You can contact me or any members of the events team. We can put you onto the right place. So looking forward to keeping you updated and the rest of the program. So with that, I will thank you for your attention and turn it back over to you, Suhana.
Expression website manner. I never thought of it that way, but you know what? You're absolutely right. And maybe it's a skill that our clinicians and practitioners will have to learn in this whole new sort of universe. But thank you for the presentation. And Sheila mentioned the importance of that survey. And again, I hearken back to the survey that we've asked you to fill out to get your feedback to make these sessions more geared towards the things that you would like to hear more about. We do have a jam-packed session coming up next around a national survey conducted by Infoway and the Canadian Medical Association on virtual care adoption by physicians. It's interesting because in the prior sessions, and Sheila mentioned this is number 4, there were many questions about how viable this would be, how embraced it would be, not just by patients certainly, but by clinicians as well and physicians. So this leads me to welcoming our next guest, Sukertha Tharmalingam, Manager of Evaluation Methods at Infoway, to share some of the results from this survey. Hello to you, Sukertha.
Hello, and thank you, Suhana, for the introduction, and thank you for everyone that's joining today. I'm very excited to have the opportunity to share with all of you the new findings from the 2021 National Survey of Canadian Physicians, jointly conducted by the CMA and Infoway. We learned a great deal from this survey, and I'm really hoping that over the next 15 minutes, I can share some of the highlights of those findings. Then I'm really looking forward to the discussion that'll follow with the president of the Canadian Medical Association, Dr. Ann Collins, as well as CEO and president of Infoway, Michael Green. So a bit of background into the survey. Earlier this year, we partnered with the Infoway and CMA partner to conduct this survey to really get a sense of where physicians were in terms of their uptake of virtual care. And we felt it was a great time because we were a year into the pandemic since COVID-19, and we wanted to get their perceptions on the benefits, the barriers, and anticipated future use. We also had some questions examining the use of other digital health tools as well. Quick overview of the methodology. This was a 10-minute survey conducted online that went to the CMA membership. We included physicians that were providing direct care, so that included your GPs, specialists, as well as residents. In total, we had 2,071 physicians respond, and this sample was weighted to be representative of the CMA workforce. And this is what the respondent profile looked like. So just under half of the respondents were family physicians. We had respondents across the country represented, as well as physicians practicing in both community and hospital settings. Just under half of the respondents were women, and the average age was 47, reflective of the national physician population. So now we'll get to the interesting parts of the survey, really diving into the findings. And here I have on the screen a definition of virtual care that we've used from the Women's College Hospitals Institute for Health System Solutions in Virtual Care. And we provided physicians with this definition prior to asking some of the questions around virtual care. What we've got on this slide is perhaps the most compelling finding from this survey in illustrating really the dramatic shift that we've seen in virtual care since the COVID-19 pandemic. Our survey found that nearly all physicians are using virtual care methods in their practice. We have just 6% of physicians saying that they're only providing inpatient care. The most commonly used modality is telephone, with 93% of physicians stating they're using that method. Half of physicians are using video methods, and a third using messaging or email. And about 5% are using remote patient monitoring or home health monitoring solutions. When we compare this with the spring of 2020, just as the pandemic had hit, the CMA had conducted a poll to get a sense of what the uptake of virtual care was. And so you can see there that we've seen an increase globally across all the different modalities of virtual care modalities. The telephone is virtually sort of universal in physician care practice. We've seen a drastic jump in the use of video, with a third of physicians that were using it in springtime of last year compared to half of physicians now. And similar, the use of messaging is also doubled to about a third of physicians that are currently using them. We asked physicians to estimate what proportion of their visits are actually conducted through virtual care means and in person. And what we find here is that physicians are operating in a hybrid environment, in the sense that in-person visits still remain the most common type of consults for physicians. Half of patients are currently being seen in person, compared to 4 in 10 by telephone and only 1 in 10 by video, as well as 2% through email or messaging. When we asked physicians about their satisfaction with the different modalities of care, what we've got there is the red bar is the use, and then in the green bar, we've indicated the satisfaction. So fairly high satisfaction, 7 in 10 physicians reporting that they're satisfied with telephone and video methods of providing care. About 50% are satisfied with email and messaging, as well as remote monitoring. When we examine those satisfactions a little bit more in detail and unpack it, we can see that there's some work ahead of us. So across all modalities, there are about 20% of physicians, or 1 in 5, that have expressed dissatisfaction for all of those modalities. So there's some exploration to do there. Additionally, there's an interesting group when we look at the messaging as well as the remote patient monitoring group. About 30% of the users have neutral sentiments around the satisfaction. We also examine the perceptions around the ease of use of each modality by asking physicians how easy it was for them to provide care through these methods, as well as for their patients to receive care through these methods. Phone is universally seen to be the easiest virtual care by both physicians and their patients, but fairly high agreements when we look at video and messaging as well. When we asked physicians what their patients' interest is in receiving more care through these specific modalities, the desire is fairly consistent across the modalities. However, when it comes to physicians' preference, that's where we find that physicians want to be providing more care through a video compared to telephone and messaging. We also asked physicians that are currently not using specific virtual care methods what if they would like to be able to use it. So among physicians that are not using telephone, and remember this was a small group, about 12% of them say they'd like to be using it. So what we get here is that those that want to be using telephone are likely using that method to provide care. Where we're seeing more interesting findings is when we look at the physician population that's not currently providing care through video, 41% of them would like to be able to provide care through video. 34% of those that are not using messaging would like to start using messaging. We also asked physicians to rate their agreement on a number of different aspects of using virtual care in practice. And this slide sort of illustrates that. The first highlight I'd like to draw your attention to is that 84% of physicians are saying agree that virtual care is improving their patients' access to care. Additionally, when it comes to other aspects of patient care, we have about 3/4 of physicians saying that virtual care is enabling them to provide quality care, more efficient care, and they're satisfied with the time that they're spending with patients during those virtual care encounters. There are nuances around these findings, particularly when we're talking about quality of care, and I'm hoping that we'll get to address some of these later in our discussion. Additionally, what we're seeing here is fairly high agreements on having the knowledge and skills to be able to use virtual care, satisfaction with the privacy and security settings, and as well as their ability to easily integrate it into workflow. Where we start seeing less agreement by half of physicians or less is when it comes to the impact virtual care has on improving workload, their satisfaction with work, and managing that work-life balance, as well as the quality of patient-provider interactions and the ability to collaborate with other providers and their colleagues. So we saw some fairly positive perceptions around virtual care in the previous slide, but we also identified numerous challenges or barriers that remain. The greatest challenge that were reported by physicians, without surprise, is the ability to virtually examine patients. We're currently operating in an environment due to the pandemic where the freedom to maybe choose the appropriate modality, the freedom to choose the modality you want might not exist. The next most cited challenge by about half of the physicians was that there are some patients in communities in their patient population that are unable to access virtual care. This is interesting because in the previous slide, we did see that virtual care is enabling access, but I think what we're learning here is that it's not a universal enablement, and there are parts of the patient population that we'll need to pay attention to. There are also other challenges with respect to patients' preferences for in-person appointments and maintaining those appropriate boundaries with patients, particularly when it comes to messaging, as well as balancing that mix of in-person and virtual care visits. And we have about 1 in 5 physicians or more reporting other challenges related to the aspects of technology. So this includes things like their ability to log into that technology and the functionalities that are available and the setup process that it's taken them to integrate into their workflow. Inadequate remuneration was another challenge that was raised, as well as interoperability with EMR and integrating it with systems that they're currently using in their practice, as well as access to broadband internet connectivity, as well as licensure issues were some of the challenges that we're seeing raised by physicians. Thinking about equitable access to care, we inserted a question asking physicians to identify if there are groups in their patient population that may need additional support to access virtual care. The finding from this questions are somewhat nuanced as well, because we are asking physicians to speak on behalf of their patients. But we did do this with the intent of trying to capture patients that we might traditionally have challenges capturing in the patient survey methodologies that we might not be reaching. So what we were seeing is that the greatest support needed was for patients with low levels of technology literacy. Physicians also identified additional supports were needed to address patients with language barriers, disabilities, mental health concerns, low incomes, chronic conditions, children, and those who are from remote locations, as well as Indigenous communities. So this slide gives us a sense of the gradient of particular patient groups and patient populations we want to be paying attention to as we move forward in virtual care. And this is the last slide I've got here on the highlighting the findings from virtual care. And perhaps the most important finding for all of us is we asked physicians about their anticipated use of virtual care post the pandemic. And what we're seeing is that virtual care is definitely part of the care mix moving forward. 96% of physicians say they will be using it. 64% say they're either going to maintain their current level of use or increase their use. The small group of physicians who weren't using virtual care, their interest continues to be very low in starting to use virtual care. That's the 15%. I'll close off with some additional findings that we've got in terms of the use of EMR, as well as other digital health tools in practice by physicians. The use of EMR has increased. Very encouraging to see that 93% of family physicians are currently using EMRs in their practice. And that's an increase from 86% when we last evaluated this in 2019. And we're at varying levels of adoption across the country. When we asked about the use of electronic tools and functionalities that physicians are currently using in their practice to manage patient care, there is a mix of tools that physicians are using. And what I want to draw your attention to is that 80% of physicians are using some mix of electronic ordering or functionalities like clinical decision support, drug interaction warnings, online booking, online renewals. So different functionalities are being used by about 80% of physicians. We also asked about physicians' communications with other providers or other practice settings, and that happens directly from their practice system with external practice system, and we really tried to encourage them to not think about facts. And what we're seeing here again, and I want to draw your attention to the different types of functionalities we were looking at. About 9 in 10 physicians are using one or more of these tools in their practice. So that could be getting results, lab and diagnostic test results directly into their practice system, getting information about care that their patients received in a hospital environment or other practice settings into their practice system. So this gives us a sense of the degree to which clinicians are practicing in a digital environment currently. So I've done a quick summary of the key findings from the survey. These findings are encouraging in many ways, but are also nuanced and lots of opportunities and challenges, which we'll get to discussing shortly. But before that, I do want to mention that you can find the full report of the results from the survey on our website. As well, I encourage you to check out Infoway Insights if you're interested in some of the detailed findings or specific cuts of this data, where Infoway Insights is a self-serve analytics website where you can go in and extract custom parts of this data if you're interested. All right, now we'll move on to the exciting parts of this discussion. I get the privilege of inviting the President of the Canadian Medical Association, Dr. Ann Collins, as well as CEO and President of Canada Health Infoway, Michael Green, to join us and helping us to unpack some of the findings that I just presented. So welcome both, and I'll start with the first question I've got is maybe a quick question, but quickly, I want to find out from both of you, what were the most striking findings for you in some of the highlights that I've presented? Michael, maybe I'll start with you and then go on to Dr. Collins.
Hi, well, thanks very much. Good analysis of the results and everything. I think for me, the striking thing was the, speed in which virtual care was adopted, both phone and video. And, I think it was great to see the medical profession really embrace the technology in the way they did. And the high number of visits that were dealt with by virtual means. And, I think that, it is kind of new technology for many people. And there are obviously some teething problems, but I think that in general, it's really positive results from the survey, and also, some good future predictions about how the technology could be further used, and also some great lessons learned.
Great, thank you. And Dr. Collins, what were the most striking findings for you?
Well, thanks very much for your overview of the survey. I think what was great to see was the uptake by physicians of the three modalities of providing virtual care. Even though there was a doubling of secure messaging and emailing from 18% to 36%, we know it still lags behind other delivery methods. And we also know from looking at data from Kaiser Permanente in their system in 2019, that it is something that can have higher uptake. And I think even your data about physicians, a third or more physicians wanting to use this more often. And although payers were very quick to stand up and provide support for virtual care, this is one of those modalities in which there is not a payment model in existence. So this is something that certainly needs further exploration and further work to support this modality of virtual care.
Great, thank you. And so maybe thinking ahead, what do these findings mean for our organization's work? So Michael, I'll start with you. What does this mean for the work that Infoway is doing?
Yeah, I think the implications for Infoway is really a kind of focus on how can we support these programs going forward. And part of it is working with the provinces and the healthcare providers, in terms of helping in selecting solutions, helping with the implementation of the programs, and also looking at lessons learned and how we can kind of get that collective intelligence together to really make the patient and the physician-clinician experience better going forward. So that's a really kind of important element of it. And I think when we also analyze some of the areas that created perhaps some problems in use of the technology, we can look at, for example, to provide a better kind of integrated desktop for clinicians to be able to use their systems more effectively and get access to patient information and other resources when they're providing virtual care. And then finally, I think we have fairly close partnerships with industry. And when I mentioned earlier about working with the provinces, we have run some initiatives in procurement. And again, I think this is something that we can help save a lot of time, effort, and money by helping with some coordinated procurement exercises going forward to really ensure the speedy and trouble-free delivery of this technology across the country.
Great. And for the CMA, what do these findings mean moving forward?
Well, I think it's clear, that physicians are using virtual care, that they'll continue to use virtual care, and see that in many instances their patients prefer to use virtual care. However, there do remain challenges, certainly around issues like remuneration, licensure, and workflow. And so our work will require making sure that there is coordinated policy and governance in a national way to deal with these issues. And also, we need to continue to ensure that virtual care is used appropriately and in the right circumstances.
Maybe I'll follow up with you on that. Who do you think doctors want to hear from, physicians want to hear from on that appropriateness and application of virtual care?
Well, first and foremost, we should and do want to hear from our patients, and in many instances, their care providers, about their needs and satisfaction. And also then, and I had this opportunity yesterday with two early career physicians to hear what their experience has been like in using virtual care. And as physicians, we learn from each other what works for example, what works for them in their office, what has not worked. So we really need to be speaking to each other about this.
Great. So maybe I'll dive into one of the specific results that I presented, where we saw that virtually all physicians say they'll continue to provide virtual care post-pandemic. So 94% said it's part of their care mix. 64% though said they'll increase or maintain use. There were 32% that say they want to decrease the use. So is this a concern? And Dr. Collins, I'll turn it to you first to respond to that.
I don't think it is. I think that there are probably physicians within that group, because of restrictions placed on us in our practices by the pandemic, by public health restrictions, who have had to see or interact with more patients in a virtual modality than they would have wanted to. And again, there are all the other challenges that we've already talked about around virtual care visits. So I think that what we may be seeing there is a rebalancing, if you will, that they will still continue to use virtual care, but post-pandemic will feel more comfortable or feel less restricted in seeing those patients that certainly need to be seen in an in-person environment. So their level of comfort in seeing people in their offices will increase after whenever that is the pandemic. We are post-pandemic.
Great. And Michael, how do you interpret the 32% that say they want to decrease their use of virtual care?
I think the physicians have kind of learnt new experience of using the technology. And, I really think that, most physicians know what's best and how they can deliver their care. And, I think that really they're kind of looking at, using the technology in the best way going forward. And everybody knows that there's still a need for face-to-face visits. And perhaps during the pandemic, when the kind of infection rate was very high, the vaccine rate was very low, maybe there was more pressure to use virtual care for some instances, perhaps that in more normal times, one might want to do a face-to-face visit. So again, I think it really is a positive result that a lot of people want to continue using the technology and choosing the circumstances in which they use it. And, I think patients obviously can provide some very good feedback in terms of what they like and didn't like about the experience. But overall, I think it's positive, and I think it should be up to the individual physicians to decide how they use the different modalities and face-to-face care going forward.
Great. And I'll actually follow up on that. And that's what we saw in the survey results, where half of patient visits are conducted, and we've got the range of the uptake of different modalities, but half of patient visits are conducted in person. And Dr. Collins, maybe I'll be trying to make sense of that. So 94% of care is being offered virtually, but half of visits are in person. And maybe as a physician and as part of the leading CMA, maybe you can help us unpack that. Why is that?
Well, I think that number of 49%, and it's so close to 50%, is very telling, because we always have to remember we have two partners here. We have two players in any visit. And in some instances, it will be that the patient, for example, feels very strongly that they need to see their physician in person. And as a practicing physician who used virtual care prior to this position that I'm in now, I and my staff would do everything that we could to accommodate that, depending upon the state of restrictions during the pandemic at the time, or at least make an effort to do that at a safer time. And conversely, there are times when it is absolutely necessary that I see, or a clinician see, a patient in person, that it cannot be dealt with, the presenting problem cannot be dealt with over the telephone. And I think that certainly plays into it. If you're only doing virtual care by telephone, you're very limited in what you can. You are somewhat limited, let me say that, in terms of what you can diagnose. You need that visual component. So I think we're always going to see, we need to always see, whether it'll always remain at 49% or not, post-pandemic will be interesting to see. But it's the question of need and want, and getting that balance right. Again, coming down to the appropriateness of how and where the patient needs to be seen to deal in a very effective way clinically with their presenting problem.
That's great, thank you. So along the lines of the needs and want, this is a question for Michael. So we've got excellent results on the uptake of EMR, 93% of family physicians that are using it. Took us a long time to get there. Do you think we'll see the same thing with virtual care? Or how do you think this adoption and uptake and use will play out?
So I think that it's true that, to introduce EMRs did take some time, and that really was probably quite a big step for many physicians to make. If you're in a small practice, to move from a paper system, introduce a new kind of electronic system to manage your patients, and it would involve all the interactions of staff and so on. And, but I think the good thing about that is that with the 92% of physicians that are on EMRs, it puts them in a great position to be kind of ready for virtual care. And, I personally believe the kind of mature, or the way that technology will mature will be a lot quicker, and that everyone can learn from the lessons that we've gained from recently. And I think we can look at how we can give the physicians a better experience, how we can give them tools that link seamlessly so that they can look at a patient's history, they can do a referral, all from a kind of electronic type of desktop. So I do think I'm quite optimistic that with the amount of energy and focus on virtual care at the moment, and it certainly has got the focus of governments across the country as well as the federal government, I think there is a strong belief that we can continue to enhance virtual care and the uptake and use of the solutions to the overall benefit of the system, and really, help cope with the great demand for health services. And, I think also that there are certain, procedures that are very easily done virtually, quick visits that would hopefully free up more time for physicians to spend on those face-to-face cases and more intricate cases that they need to handle. So I'm hoping that the overall workflow for physicians will improve, make them more efficient, and also from a patient point of view, it will increase access and also increase the convenience of using their physician services.
Great. Maybe I'll switch gear now to some of the barriers results that we saw. So outside of virtually examining patients, which was the biggest cited challenge, which we can understand, the next one was the inability of some patients or communities to access virtual care. And then another follow-up question that we had did highlight that specific populations, physicians feel like specific patient populations will need some support. So one of the biggest ones was low technology literacy, as well as language barriers and other factors that came up. How do we start addressing some of these factors when it comes to these barriers? Michael, I'll start with you, and then I definitely want to hear from Dr. Collins as well.
Okay, so I think with this, I think there's a few things that I would say is that, one, from our perspective, working with providers, working with other pan-Canadian organizations, we can help with the kind of training and change management side for physicians. So we can certainly help provide resources and work with organizations like the CMA, to help in that respect. When we look at patients, I think similarly, we can put some attention there. But also, I think it's important that the solutions are good. And so, we can work with industry and work with physician groups to give feedback to companies that are providing these technical solutions to make sure they are easier to use and they're more intuitive, and so that the experience can be generally better. But certainly change management it could be a big change to someone's workflow, and I think that that's something that needs some focus in terms of how we can support those resources. And we're open and very willing to work with CMA and other organizations to try and help identify the needs of the users to make the technology more seamless going forward.
And Dr. Collins, what are your thoughts on some of these barriers?
Well, certainly I agree with what's been said, and always appreciate collaboration for the betterment of patient care. One of the major issues is around digital literacy. And what we have advocated for at CMA is that the federal government establish a secretariat that really allows to collect data on, yes, we know there are differences in terms of patient A and patient B's ability to work with digital technology, and in fact, physicians as well. But if we don't have data around that, then we do not really, as with anything, know where to direct our energies going forward and how to make things, how to improve that situation for patients. So that's what we have advocated for, is a system, and we would be willing to work with, for example, Stats Canada on that, to get some preliminary data on where exactly we stand with respect to digital literacy.
I'll ask a question here from the audience, and the question is, technology is generally adopted to improve efficiency or save time, but clinicians are reporting an increased workload. Are there any specific areas that have been identified that can help improve that workload? Maybe I'll start with Dr. Collins and then go to Michael.
Yeah, that's a good question, and I think that again, time will tell. I think the reason around the workload increase is in part having to adapt not just to virtual care, but to so many other aspects that we've had to adapt to within this pandemic. And then bringing on a new, even though it does provide access and in many cases improves care, that adaptation, along with dealing with the pandemic, has probably colored the response there. I'm thinking that's so. I'm sure that there will be, with advanced technology, increased use, increased comfort. That number will, I suspect, change.
Great. Michael, do you have anything to add to that?
Well, I think there is kind of well-documented evidence, that, for example, with the adoption of EMRs and EHRs has kind of increased physician burnout, and really with physicians being expected to spend a lot more time working on their keyboards as well as seeing patients and so on. And I think, again, that's an issue overall for the industry as well. Because technology should be there to improve the experience and to take work away and make it a more streamlined experience going forward. There is always, when you're changing technologies or changing work practices, there is a period where it's probably going to be more difficult. But after that, work should get easier. It should release time. It should make time for physicians to spend their focus on what really needs to be done. And so I think it's important, and Dr. Collins was talking about getting the data, and I think we need to understand where the log jams are, where we can help. And I think with programs, training programs and so on, that can certainly be helped. I think the private sector can also be helped in designing really good solutions going forward that are easy to use. So I think it's a very important topic that needs to be followed up on and looked at critically, really, to ensure the continued success of virtual care going forward.
Great. And maybe I'll follow up with a question for you, Michael, in terms of, we've been hearing a lot about, and these findings certainly indicate it, about how virtual care is here to stay. That's what the survey indicates. I'm curious to hear from both of you on what does ideal virtual care look like. So we're seeing the interest, we're seeing that it's part of care, but what does this ideal virtual care world look like?
That's an interesting one. So it's, I think that maybe our views might change over time with that. But, I think that an ideal world is one really that does, where virtual care is really making a big impact on improving physician care and the life of a physician, and very importantly, improving patient care and access. Now, I know that we're measuring a number of areas, like we look at the cost savings to the economy by reducing the number of unnecessary visits, for example, and the economic benefits for patients in terms of time saved and everything else. So I think there's a number of things we can monitor. But the key area, I think, really is going to be in continuous improvement, gathering kind of satisfaction. And then finally, on this point, really, we've done a lot of surveys looking at what patients want from virtual care. And, patients want to be able to contact their doctors virtually by phone or video. They want to be able to get their lab tests without having to have a visit. They want to be able to do prescriptions online as well. So there are some kind of, and referrals and booking appointments. So there are, 4 or 5 kind of really basic services that lots of Canadians would love to see as routine part of their healthcare. And so hopefully when we come back in a year or so, we see that journey maturing. But I think perceptions will change as the technology gets broader adoption. And it's something we need to be continuously looking at to see how we can really improve the experience going forward.
And Dr. Collins, from your perspective, at the physician perspective, what does ideal virtual care look like?
Well, ideal virtual care would, first of all, not compromise patient care in any way. Ideally, it would improve patient care. And ideally, it would allow for good continuity of care for the patient and collaboration, easier communication even. I think we have a wonderful opportunity before us with what the pandemic has allowed or forced and allowed us to do with respect to virtual care. So improving patient care from a physician's perspective is always number one. Ideally, yes, to make workflow, communication easier for physicians, because there's been such incredible stress on all of us, really, all Canadians, but anybody in healthcare. So anything that can ease that, make work-life balance improved or better for practicing physicians, also would be of great benefit.
Great. Thank you both. This has been so informative. It's been very helpful to unpack these findings, hear your perspectives on the findings. We're getting to the end of this session. Before we wrap up, any parting words from either of you regarding just, this is a new set of findings. We haven't heard this voice much before, and we're also in a new era of understanding these findings. So any parting words before we wrap up?
I would just like to say, I appreciate our cooperation, partnership with the CMA, and we're looking forward to working together with the team from the CMA and see how we can jointly kind of follow up on virtual care and ensure that it really is a benefit for patients and the physicians that are providing those services going forward.
Thank you, Michael, and likewise here on behalf of CMA. My parting words would be that virtual care sort of had a premature delivery and is still in its infancy, but growing rapidly towards toddlerhood and onwards. And with respect to our vision as the CMA, vibrant profession and a healthy population, I think we need to really keep our eye on the outcome of virtual care and the quality of care for patients and the impact that this has on our physicians as well. And thank you.
Thank you. Thank you both. It's been a privilege to have both of you to help discuss these findings. And now I'll turn it over to Suhana.
Thank you so much. Sikartha, great job. I'm applauding you. Fantastic conversation. Michael, I'm mesmerized by the picture behind you. It's beautiful. And Dr. Collins, every toddler grows up and then they want to borrow the car. So beware. But I agree with you. I think we're heading to that ideal world. I hope it's sooner rather than later. And sign me up. Thank you all. Great job. It is time now. We'll take a quick pause. And really what this will do is give you a chance to check out the industry showcase. and, top up your beverage. I've still got my coffee going. Infoway partners that have made this session possible and complimentary, by the way, for all attendees, are available to answer your questions, to talk to you about developments in the industry, maybe take some of those questions and some of those answers a little bit further, should you wish. I will ask you one thing, though. If you could meet us back on the main stage at 2:05, so that gives us 6 minutes or so, and we will continue with our program. I will see you then at 2:05 Eastern. Until then, enjoy your conversations. Hello, everyone, and welcome back. I hope you had a chance to check out the industry showcase. Take a little break as we now get right back into our program. It is my pleasure to welcome Dr. Michelle Grinman to this virtual stage. She will discuss the evolution of virtual care from a physician's perspective around this COVID-19 pandemic. So I welcome you as well to check out her bio. It is in the program. Hello to you, Dr. Grinman.
And I have to say that I was really honored when I was asked to do this talk. I think of myself as a clinician, as a researcher, as a medical leader. But when I thought about it, I guess over time, as I've developed models of care, virtual care has come to the forefront as a way of connecting patients and connecting providers. So I will be talking about my experience as a clinician that has used virtual care since 2011 and how it has changed with the pandemic. My slides are, there we go. Sorry, my clicker moved out of the way. Here we go. So thanks so much for having me. As I said, I'm a general internal medicine specialist in Calgary, and I also develop models of care for vulnerable populations. For this talk, I have no real disclosures. I have no conflicts of interest. And to the best of my knowledge, this talk aligns with the copyright and intellectual property standards. And sort of the objectives for the talk. So what I was asked to do is talk about how virtual care has evolved and my perspective as a clinician who has used it and implemented it over time. And so I'll talk about a little bit about that, as well as some of the lessons learned in terms of barriers and facilitators to incorporating virtual technology in my everyday care. And I'll also have a brief discussion on the potential applications for virtual healthcare delivery in the future. So just to whet your appetite a little bit on some of the potential that you can unlock with virtual care. So when I was trying to think about how best to talk about the evolution of virtual care, I was sort of hunting for the history of when did it really start. And I found this really interesting article that's about 10 years old, talking about the evolution of telehealth and how did it start, where are we going? And so this was obviously pre-pandemic. And it talked a little bit about sort of a timeline of when did we really start thinking about how to incorporate technology in the use of care from a virtual perspective, right? Because stethoscopes and things like that have always been evolving over time. But it really started with the use of the telephone. And I found it kind of interesting when I was listening, to the results of the CMA and Health Infoway survey, that the majority of virtual care is being done with a telephone. So this, this idea actually started in the late 1800s when Alexander Graham Bell invented the telephone. People started thinking, well, maybe we could get medical advice remotely. And then there was an interesting cover of a magazine in the 1920s thinking about how to use radio to make remote diagnoses. And to be honest, I'm not exactly sure how they were thinking of doing that, but the idea of using technology, of being creative and applying it to a clinical population it started quite earlier than we realize. And then in the 1950s, actually a group in Manitoba did what was called the telecardiogram, where they put an ECG machine on a patient, and the ECG was actually interpreted a kilometer away in the hospital. And we do this all the time now with Holter monitors, but that started in the 1950s. And then in the 1970s, NASA became involved in and NASA is a very big stakeholder in virtual care, as you can imagine, because they need their astronauts to be able to take care of themselves in space, and they don't always have a physician on board, or they don't always have all the materials on board that they need. So they need to be able to do remote diagnoses, remote care. And so they became involved in an initiative in Phoenix with the Indian health system, where they provided care remotely. They were able to support the care of a remote population or a rural population remotely. And they were involved sort of in the mid 1970s, and then this program continued until the 1980s. So, when we think of virtual care, and right now it seems to us that this just came on the scene, actually we've been doing this for a long time, just in small pockets. And then if you fast forward into kind of the 1990s and 2000s, which is more closer to the type of technology that we see now, office-based telemedicine started happening. We started seeing teleradiology, where some of our X-rays and CT scans are being sent overseas to be interpreted by radiologists in other parts of the world. And we started seeing the emergence of both synchronous consultation and asynchronous, meaning not at the same time. So things like teledermatology, teleophthalmology. So I'll talk a little bit about, in parallel, how did I become involved with this? Because really, I'm a general internal medicine physician with a public health master's, and really never intended to develop knowledge of virtual technology. But over time, as I learned more about what patients want, how to improve transitions of care, how to improve the communication between patients and their providers, and also the healthcare team in general, which also includes patients and their informal caregivers, that enabled at least me with my endeavors to help patients become active participants in their care planning and in their self-management and in their connection to their healthcare team. So I started out in Toronto supporting as an internist, as a consultant for a family health team doing impact clinics. And an impact clinic, initially it started out as a sort of hybrid in virtual and in-person assessment of a patient, where the patient was in the clinic with a closed monitor camera, and then the healthcare team sat in another room, and then we unpacked a very complex case, and we often had the family doctor either by phone or by video conferencing. And then it evolved where the patient was in their own home or with their family doctor, and then our team was kind of lent to the solo family doctor. And this, for me, was the sort of the stepping stone to starting to use this video technology. I actually incorporated it into my clinic, so I would see patients in person, and then I would do these teleconsultations, and then I'd go back to seeing patients in person. As we had a nurse that would run around Toronto and setting up the video, and as she was doing that, I would see my in-person patients and then go back to doing my teleconsultations. And then I co-led the development of a kind of quality improvement outreach program called the Integrated Long-Term Care Program in Toronto that was reaching out to the long-term care homes in the catchment area of Toronto East General Hospital, which I know is now called Mark Guerin Hospital. And what we were looking at there, we used telemedicine to support clinical consultation, so bringing specialists into the long-term care home to support palliative care and myself for acute care. And we had a nurse practitioner that did proactive goals of care discussions. And then we also used it to do monthly case conferences to build sort of capacity amongst the team within long-term care and to connect to specialists. And then in 2015, I was recruited back to Calgary, and I was asked to develop a platform for the community, for our seniors population that surrounds the hospital that I work at. And so I developed something called the Complex Care Hub, which is essentially a hospital at home that is a hybrid of in-person and virtual care. And so you can see we have a hospital-based team where we have a physician and a nurse navigator that are in the hospital. That's where we recruit the majority of our patients. And we have a clinic space where we can see them in person if we need to, and we can expedite their investigations. And then we have a home visiting team, which includes community paramedics that assess the patients. They're able to do labs, ECGs, and IV medications for us. And then they consult with the physician remotely, either by video conference or phone. And then we're able to co-document on a shared electronic health record where, for example, I can order a medication while I'm sitting in the hospital, and the community paramedic will go give the medication, sign it off in the electronic health record. And so I have that entire record at my disposal, and we co-communicate. So we have one source of truth for our information. With the pandemic, Alberta Health Services was interested in expanding the ability of their virtual hospitals, so Complex Care Hub, as well as our partners in Edmonton. We worked together to get a digital remote patient monitoring solution where patients could get their own physiologic data, so their own vital signs, and they could connect directly with the physician through secure video conferencing. And we delivered more than 450 kits across the province. It enabled us to increase our patient census and to transition even further to a hybrid in-person and virtual care model. So I no longer need the community paramedics to be in the home if all I need is a virtual visit, because now I have vitals and I have the video conferencing. And as you can see, patients felt that improved the quality of their care, it improved their ability to connect with healthcare providers, and the same thing for our providers. About 80% of them felt that the quality of care they were able to deliver was improved or enhanced with, I wouldn't say improved, but enhanced by the digital remote patient monitoring. So that was my experience. What happened with the pandemic is, I think, as we heard in the previous talks, that the pandemic facilitated the expansion, or the, I would call, explosion of virtual care. And so we saw that, the majority of Canadians accessed care through virtual methods, things like telecardiology. From my perspective, hospital at home really started to expand, especially in other countries like Spain and the United States and France. They saw that hospital at home provided an opportunity to prevent in-hospital transmission. And here in Canada, we had the emergence of the hospital at home in Victoria, and the plan for potentially spreading it across BC. And this is kind of, I found a survey that the CMA did with Abacus at the beginning of the pandemic. And it's interesting to me to see the sort of the shift in how physicians were thinking. This was more about what Canadians were experiencing in terms of the use of virtual care. So they surveyed 1,800 Canadians and asked them about their use of virtual care sort of pre and during pandemic. And it was at the very beginning, like in May 2020. Overall, what they found was that at the beginning of the pandemic or before the pandemic, people preferred in-person care and were highly satisfied, but were generally satisfied with virtual care. And then during the pandemic, they started to shift more to using virtual methods and were more satisfied with that than with even emerge visits. And I think that just speaks to the fear that people had of coming to the hospital or being in person in medical offices. So they were asked at the beginning, how would you normally access the care you need if you had an illness or a medical condition? And you can see that about 61% of Canadians surveyed in the survey used in person, and that the sort of virtual modalities were much less used in terms of what they considered to be their normal way of accessing care prior to the pandemic. When asked about their, first of all, what kind of virtual technology they've used, you can see the majority, if they did use any virtual technology, would use phones, and then much less so in terms of video or text. But you can see a good deal of satisfaction with these modalities of care. On the right-hand side, the green marks their satisfaction. And then they were asked, well, since the pandemic started, if you needed advice from a doctor now, what would you use? And you can see, the emergence of virtual modalities like the phone. There started to be more video conferencing and more of the virtual rather than in person. And then they were asked, well, if in the future, what would be your ideal first point of contact with the healthcare system? You can see that still, 2/3 of Canadians at that time felt that they still wanted to see their physician or their healthcare provider in person, but there was starting to be the emergence who would rather start virtually, and then if they need, they would go to. And same thing here. So if you had the choice in the future, would you choose as the first way to seek a doctor's advice? And you can see, in person still wins, which I think is still valid, and we shouldn't be replacing all in-person care because there is value to the physical exam and there are things you can't do virtually, but that the emergence of virtual technology started to creep in there. So from my perspective, what barriers have I encountered as I've developed these different programs that I've developed over time, when I was implementing virtual technology, pre-pandemic, I found that a lot of people had inertia or fear of using the technology, especially when there's unclear processes or standards or workflows that if it's not easy to use, or if it's not something that's familiar to people, they're much less likely to adopt it. The other big barrier would be variable connectivity. So when talking, for example, about the survey that we heard about, from an equity standpoint, there are pockets of the country where people don't have the same connectivity to or access to the internet. And so if you choose a technology, you have to choose something that you know is going to work reliably in their area. And it might mean that the technology you use has its own internet connection and doesn't rely on the patient's connection. The other thing was age. So we were really worried when we used when we first adopted our digital remote patient monitoring solution, that what if the patients, especially in our population, 2/3 are seniors and a lot of them are 80 and 90 years old, would they be able to use it? So we picked a solution that we knew had been tested in seniors. We knew that it had large font and it was easy to use. And we were actually pleasantly surprised that our 80 and 90-year-olds, I think what we don't realize is that although, yes, they're of a different generation, a lot of them have smart technology because they need to connect with their their grandchildren and their children. And so a lot of them actually do know how to use a smartphone. And so as long as you pick something that's easy, an easy interface, they will be able to adopt it in most cases. The other thing would be, from an equity standpoint, social determinants. So low income, again, they may not have their own technology, so you might need to provide it, and understand that some of that technology, may, depending on where it's being deployed, may either get damaged or not come back to you, and you have to have provisions for those things. Also, language barriers. You have to know how you're going to have an interpreter available if you're doing virtual care. And one thing that came out of the physician survey, which I've encountered for every initiative that I've done, is reimbursement challenges. So virtual care has traditionally not been very well reimbursed, and so people haven't adopted it because they haven't been able to equate it with the type of care that they do elsewhere. And then in terms of facilitators, so in your organization, I think you need senior leadership support. You need to decide what technology is appropriate for the clinical needs. So just because you have technology doesn't mean it's going to make your care better. It has to be technology that enhances the care that you're already providing, that it goes along with and enhances the standard of care. Having clear processes and standards goes a long way. It eliminates people's fears and it gives them a sense of direction of what they need to be doing and how it's safe to provide this type of care. And with those processes and standards, having a champion on the ground when you're implementing the technology is very helpful. I know I was hearing about Infoway supporting change management. This is a huge and crucial piece to being able to use this technology, is understanding that different people have different ways of adopting technology and understanding how to use it. And as I said, I think COVID really facilitated the use of virtual care. But what I worry about is that we don't just use technology for the sake of using it, but that we use it adapted to the clinical situation and need. And I think, at least in our province, there's been at least a temporary change in the reimbursement so that virtual care could be provided. And I think that this goes a long way to getting people to adopt it. So what might be the future of healthcare? Well, first of all, why would it be here to stay? And I think there's many reasons. We've gotten used to using it. Patients find it more convenient. There's an ecological possible benefit, that thus less travel, less use of fossil fuels for traveling, better access for vulnerable populations that may not be able to travel into a clinic or a hospital. And from the survey that you heard about, most physicians that are already using the technology are thinking of continuing to use it in some way. And so I think it's here to stay. Whether it's going to be to the same level remains to be seen, but I don't think that virtual care is going away. Some other things that are, I think, compelling us to start using. So once you start thinking about how you can apply technology to your practice, then you start seeing it in every other application, right? So your creativity is kind of your limit. The emergence of wearables, the emergence of artificial intelligence, I think those things are going to start driving some of the innovations that we see in healthcare. Also, the way that we develop our supply chains. So there's an organization called Medically Home in the United States that during the pandemic developed a national supply chain with local providers. So they do their remote monitoring in one part of the United States, and then they have supply chains for everything that they need and for their healthcare providers across the country. And I think that Canada has the potential to do that, especially, having Health Infoway, having the CMA. We have the potential, and the economy of scale is probably going to be beneficial to helping us to support clinicians to adopt this technology. In the interest of time, I'm just going to skip over this, but basically, it also enables us to think of our healthcare services in a different way. And I'll just close with one of my favorite cartoons from an Argentinian cartoonist from the 1970s and 80s, Joaquin Quino. As you can see, I think patients want to be home, they want easy access to healthcare, and they want to feel well. And so I think that the technology that we choose has to be in line with that and has to meet those needs of the patients and to enable them to involve themselves in their own self-care and their care planning.
Thank you for that, Michelle. A great presentation, and always nice to end with a cartoon and leave us with a positive thought ahead. You be well, and thank you so much. That is Dr. Michelle Grinman. So we've come to the end of another session. I will tell you that if you have missed parts of the presentation, or your colleagues are asking, I can tell you that the recording for this event will be available by next week. So you're going to get an email, for the wrap up. So please check your inbox for that. And I hearken back to that age old, let us know your thoughts. So the team at Infoway really appreciates and sifts through all of your comments, your feedback. So please complete the evaluation survey. It is at the right side of the main stage. Won't take you long, and it will help them to make the future sessions that much better. Better response means better response on the other end as well. I'd like to thank all of the sponsors for their support in making this series available. Infoway certainly couldn't have done it without their generous support. So here they are. So again, thank you to all of the sponsors, but a bigger thank you for all of you attendees from, as I mentioned, across Canada and around the world, taking the time, having the interest to be part of this series of discussions. And I certainly hope that you will get something out of it and also give something to it in your feedback. I look forward to seeing you at the next session. It's already planned, so put this in your phone. September 21st, that's when we'll get the chance to meet again virtually to talk about another part of this move to virtual care across our country. The specific program for that session will be shared with you in that wrap-up email I mentioned. So have a great rest of the day wherever you are. If the sun is shining, enjoy it. I'm Suhana Marchand, and I'll see you next month.